Good day, everyone. In this video, we are going to continue the discussion on the comprehensive application of diagnosis. In the previous video, we have introduced how to collect the clinical information and also the key points that you need to focus and the one you need to avoid on the chief complaints. The questioning should around the chief complaints. We don't ask the random questions. The questions must focus on the chief complaints, and the questions are developed from the chief complaint. In this video, we are going to talk about some principles that we need to think about when we are collecting the clinical information. The first one, the completeness and systemization of the clinical information. What do they mean and why they are important? The completeness means that when we are collecting the clinical information, we need to have a full consultation. We need to have a full idea of the patient's condition. We don't only focus on the chief complaint only. So if a patient comes to you with fever, the patient says, "Hey doctor, I got fever. I don't feel good. I feel cold all the time." And then only from here you stop. You don't get any other manifestations. You don't ask about does the patient have poor appetite and constipation or loose stool. The patient also you don't ask about. You also don't ask about the runny nose and the possible causes of the fever. So in this case, you will misdiagnose, and also the treatment won't be good. So in a consultation, we need to gather the related clinical information as much as you can in order to gain the full picture of the patient. This from the inquiry. Also, we need to integrate 4 diagnostic methods. We don't use only one diagnostic method. So some people say that I am very talented in the pulse diagnosis. So I'm going to diagnose according to the pulse only. This is not a good attitude towards the clinical practice, because from no matter how skilled you are, you will mix something from one diagnostic method. For instance, if you only diagnose from the pulse, although you are very skilled, very talented, you won't know. You might identify that the patient have pain in somewhere if you are skilled enough, and even this skill is not common. So some people, they claim that they can diagnose these aspects from the pulse, but you also won't know how painful, how severe the pain is. So these are for inquiry. Only the patient will know how pain they feel, how severe they feel. So we need to combine 4 diagnostic methods. We also need to have the physical examination done, because from the inquiry, from observation, sometimes you also need to mix something in the body, in other parts of the body. For example, a patient comes to you with bloody stool, so the patient told you that he had the bloody stool for a few days, and when he went to the toilets, he feel pain, and after the passing the stool, he can see the blood in the toilets. So from the inquiry, from the observation, the patient can see, and then you will know the clinical information. And then you think about the patient might have cancer, hey, because he was a senior patient at the age of 65 or 70, and then the blood from the stool, and then I remember the doctor who said that from a senior patient with constant bloody stool, you need to think about the cancer. But you see, from the inquiry and from the observation, you will see the patient have these possible causes, but you didn't do the physical examination, and then eventually you find out that the patient only have the hemorrhoid. The hemorrhoid also will cause the bloody stool. So you see, this diagnosis, this information is very easy to gather from the physical examination. And when you gather this physical examination, you can exclude the other diseases which will stress the patient, which will have very different treatment plans. So the completeness of the clinical information is very important. Otherwise, you will have a lot of misdiagnosis, and the misdiagnosis will lead to the wrong treatment. Because if a patient with bloody stool and you think about is the cancer, the colon cancer, the treatment is very different to the hemorrhoid. That's how to avoid this mistake is to gather the full picture of the clinical information. The systemization of the clinical information. This actually is very similar to the discussion in the previous video when we studied the inquiry. We're going to focus on the chief complaints. The questions that we are going to ask will be developed from the chief complaints. That you become a system. For instance, a patient with fever, and then you ask about those flu symptoms, runny nose, blocked nose, headache, poor appetite, stool stool. So you can see these are in one system, and these are something related. Instead of asking the random questions, then that's not systematic. You need to systemize the questions. When you systemize the questions, you will have a very clear picture of the patient. From the chief complaints, what happened to the patient? From the present disease history, what's the causes, what's the development, and which symptoms are very important, very severe at this stage, at the current stage, which one is not that severe, not that important. So these are something from systemize the clinical information. You need to gather the full picture of the patient, and then you're going to put them in orders. Put them into the orders that have a potential link among these manifestations. So these are the completeness and systematize of the clinical information. Systemization of the clinical information. The second one is the accuracy and objectivity of the clinical information. The accuracy, the most simple way to keep the accuracy is to avoid leading questions. So this is something from the inquiry we need to avoid, especially for the accuracy and objectivities. We need to gather the information from the patient, not from your textbook. Some of you might feel weird why I said that we don't gather information from the textbook. We gather information from the patient. Because this knowledge is quite obvious for everyone. But sometimes if you don't think about this, you will misunderstand and you will fall in this mistake. It's very common, especially for some students. They study very well. They remember every single word I have said. So in the clinics, there's one patient come for headache. The tongue is red with the yellow coating. The patient has a bitter taste and irritation. So the students think that the patient cause of the patient may be liver fire. That's all the symptoms the patient have with headache, with red tongue, yellow coating, and irritation. So this is a very typical symptom of the liver fire. Then the patient told you that they have poor appetite and loose stool, diarrhea. Here you feel here is where the confusion comes from. This is student think that the liver fire, the patient should have constipation, shouldn't be diarrhea. The patient should have excess hunger. That's from the textbooks. That's what I have told you. What Dr. Hu told me in the study. A patient with the liver fire will have constipation, will have excess hunger. After eating, they feel hungry easily and very quick. So this patient may be something wrong with them. So in the file, you write down that the patient have a headache, the patient is irritation and irritate, and also red tongue with yellow coating, constipation, and then good appetite. You see, in this case, you making the cases. It's not accurate. It's not objectivities because this is you study from the textbook. How we gather the clinical information, you need to take down the statements from the patient and you need to analyze from the statements. You don't compare with the textbook. This is very common happens in students, especially when you just enter the clinic. You will think that this is not something I learned from the textbooks. There are some conflicts in your symptoms. There must be something wrong with your symptoms. So you will change them. You will write down something you think so. So this is not accurate, and this also will result in misdiagnosis. The consistency of the clinical information. This is very important to identify is it a correct diagnosis or wrong diagnosis. For instance, patient with loose stool, aversion to cold, with clear urine, pale complexion, enlarged tongue, moist coating, deep pulse, deep and weak pulse. You see, these manifestations are all in one line. that the patient have yang deficiency. And the deficiency can cause the internal coldness. And then there's another patient with fever, thirsty, constipation, yellow, scanty urine, red facial complexion, red tongue with a yellow coating, rapid pulse. You see these manifestations also in one clue, in one chant of the heat. So these are the consistency of the clinical information. But sometimes in some cases, and actually many cases, you will find something conflict. For instance, you will feel something from the tongue, from the manifestation, and from the pulse. There are some conflicts. For instance, a patient with yang deficiency feel thirsty or has constipation. So these are some conflicts in the clinical information. In this condition, you need to think about, is it the clinical information is accurate and objective? So there's something from your side. And if these information are accurate, then you need to think about the causes. So this will become a more complicated clinical information. It can happen and it always happens, but you just need to double check your clinical information that you gathered is accurate and objective. The other very common condition that there's no consistency of the clinical information is the one we have discussed, the true and false symptoms. The true and false symptoms. There's also we have conflicts in the manifestations. So these are also something you need to think about in the process of the diagnosis, in the process of the consultation.